Hello everyone. Today, we're diving into the world of a medication called Jaimiess, commonly known by its brand name, Seasonique. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Jaimiess, known by its brand name Seasonique, is an oral contraceptive pill that falls under the category of combination birth control pills. This means it contains two hormones, estrogen, ethinyl estradiol, and progestin, levin or gestrel. Jaimiess is primarily used to prevent pregnancy. It works by preventing the release of an egg during your menstrual cycle, ovulation. Additionally, it makes vaginal fluid thicker to help prevent sperm from reaching an egg, fertilization, and changes the lining of the uterus to prevent attachment of a fertilized egg. If a fertilized egg does not attach to the uterus, it passes out of the body. Jaimiess is also used to treat moderate acne in women at least 14 years old who have started having menstrual periods and are also using this medication for birth control. Furthermore, it is often prescribed to regulate menstrual cycles, reduce the risk of ovarian cysts, and decrease the severity of menstrual pain. Warnings: Jaimiess comes with its set of precautions. It is not intended for women who are pregnant or those who have recently had a baby. Using this medication can increase the risk of blood clots, stroke, or heart attack, especially if you smoke and are over 35 years old. You should not take Jaimiess if you have any of the following conditions: untreated or uncontrolled high blood pressure, heart disease, a blood clotting disorder, circulation problems, diabetes with damage to your eyes, kidneys, nerves, or blood vessels, unusual vaginal bleeding, liver disease or liver cancer, severe migraine headaches, or if you smoke and are over 35 years old. Before taking this medicine. Before starting Jaimiess, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its components. You should not take this medication if you have a history of hormone-related cancer such as breast or uterine cancer, jaundice caused by pregnancy or birth control pills, or if you have ever had a heart attack, a stroke, or a blood clot. Inform your doctor if you have a history of depression, gallbladder disease, high blood pressure, or irregular menstrual cycles. If you are scheduled for surgery or will be on bed rest, you may need to stop using this medication for a short time. Side effects: all medications can have side effects, and Jaimiess is no exception. Some common side effects include nausea, vomiting, headache, bloating, breast tenderness, and swelling of the ankles/feet, fluid retention. These side effects usually decrease as your body adjusts to the medication. However, there are also serious side effects to be aware of. These include sudden numbness or weakness, especially on one side of the body, sudden severe headache, confusion, problems with vision, speech, or balance, chest pain or heavy feeling, pain spreading to the arm or shoulder, nausea, sweating, general ill feeling, and swelling in your hands, ankles, or feet. Seek medical attention immediately if you experience any of these symptoms. Additionally, there is a risk of blood clots, stroke, and heart attack, especially in women who smoke and are over 35 years old. Some women may also experience changes in their menstrual periods, such as spotting or missed periods, and these changes should be discussed with a healthcare provider. Interactions: Jaimiess might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Certain drugs can make birth control pills less effective, which could result in pregnancy. Some examples include certain seizure medications, such as barbiturates, phenytoin, carbamazepine, HIV/AIDS medications, such as ritonavir, nevirapine, and certain antibiotics, such as rifampin, rifabutin. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Jaimiess. The typical dosing schedule for Jaimiess involves taking one pill daily at the same time each day. The pack contains 84 active pills, with hormones, followed by 7 inactive pills, without hormones. You should follow the instructions on your prescription label and ask your doctor or pharmacist if you have any questions. Avoid: while on Jaimiess, it's advisable to stay hydrated and maintain a healthy diet. Given the potential for dizziness, it's wise to rise slowly from sitting or lying positions. As with many medications, it's recommended to avoid smoking, as it can increase the risk of serious cardiovascular side effects, especially in women over 35 years old. FAQ: Many wonder about the age restrictions for Jaimiess. Currently, its safety and effectiveness in individuals younger than 14 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Jaimiess. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.